If you run a clinic today, your front desk probably feels less like a reception area and more like a triage center for paperwork. The conversation around healthcare AI usually focuses on what providers should buy, but that misses the biggest shift happening right now. Insurance payers are aggressively deploying AI algorithms to process prior authorizations in claims faster than any human staff could ever match. When a payer uses an algorithm to review thousands of claims a minute, the immediate consequence for a clinic is a systematic, sweeping increase in batch denials. This fight is asymmetrical. On the left, 82% of physicians report insurer AI increases denials. On the right, 40% of practices dedicate staff exclusively to prior authorizations. Payers automate denials, while clinics throw human hours at the problem just to survive. When the other side automates against you, a manual approach is no longer neutral. It's a clear path toward falling behind in an asymmetrical fight. So you know you need to adopt technology to survive. But between aggressive vendor pitches and the fear of wasting thousands of dollars on a system that no one uses, it's easy to get paralyzed. When clinics do finally pull the trigger, they often make a critical mistake. They take a broken, inefficient internal process and apply software to it. Technology is strictly a multiplier. It doesn't fix a bad process, it just executes it at a much faster speed. To avoid this trap, you generally have two paths. You can build a custom do-it-yourself software stack by buying different tools and wiring them together, or you can hand the entire workflow over to a managed operations partner. Ultimately, the decision comes down to how you spend your bandwidth. You can manage a technology stack, or you can manage patient care. Vendors love to use the words automation and AI interchangeably. That blurry language leads clinics to buy the wrong solution for their specific operational leak. This decision tree matches problems to solutions. If a task is identical every time, you need standard automation. If it has variability and requires judgment, apply artificial intelligence. If it's highly nuanced, relational, or emotional, bypass software entirely. You need a human. Mixing these up causes immediate damage. If you route a high-risk patient in emotional crisis to a cheap automated AI phone tree, you create a massive clinical and liability risk. On the flip side, paying an expensive, highly trained staff member to sit on hold for hours checking standard insurance eligibility is a massive waste. Specificity is the difference between a successful technological upgrade and an expensive piece of abandoned software. Before you even consider anything labeled artificial intelligence, you have to master the unglamorous basics. Consider patient intake. Handing a patient a clipboard to fill out paper forms and manually typing that data into an EMR takes 10 to 15 minutes. A digital flow that sends data straight into the chart cuts that to under 2 minutes. When you apply that 13-minute difference across thousands of visits a year, it translates into hundreds of thousands of saved front desk hours. Similarly, implementing a strict automated SMS text reminder system consistently reduces practice no-shows by 38 to 50%. Even when you move into AI, like using ambient scribing tools to draft clinical notes, you have to be realistic.
They are highly effective at reducing physician burnout and after-hours pajama time, but they do absolutely nothing to solve your front desk backlog or your billing bottlenecks. The highest return on investment in clinic technology comes from prioritizing boring automation first. Capturing those mature, measurable wins is what funds all your future innovations. Knowing what to automate is only half the battle. Now you have to execute. And that brings us back to the choice between building a DIY stack or using a managed partner like Carentix. This matrix compares approaches. On the DIY side, clinics individually vet vendors, force disconnected software to communicate, and pull staff for training. Your manager becomes full-time IT support. With Carentix, you receive pre-integrated, HIPAA-compliant workflows already built and tested. Out of the box, it covers critical operational leaks, automated patient intake, persistent reminders, and call overflow triage when your front desk is overwhelmed. The trade-off is straightforward. You give up the ability to handpick every individual software logo, but in exchange, you get guaranteed immediate workflow execution. A managed partner lets your clinic reap the financial benefits of an automated back office without carrying the crippling burden of actually babysitting the technology. If you do decide to evaluate tools on your own, be careful. Right now, almost every vendor claims their software is AI-powered, which makes initial sales demos dangerously misleading. This vetting checklist lays out the non-negotiables you need before signing any contract. The absolute baseline is a business associate agreement. If a vendor touches protected health information and refuses to sign a BAA, walk away immediately. You also need explicit clarity on data handling. You must verify exactly how long your patient data is retained and whether the vendor is using your PHI to train their public AI models. For any patient-facing tool, establish clear human escalation protocols so a patient is never trapped in an endless digital loop when they need real help. Skipping this due diligence because you're excited about a fast software deployment is a direct path to severe legal liability and dangerous PHI exposure. Ultimately, your path depends on your scale. Massive hospital systems with dedicated IT departments, compliance officers, and large change management budgets are the right candidates to build and manage a complex, multi-software stack. But if you run an independent mental health clinic, a therapy practice, or a primary care office, your operations are already strained. Attempting to build and maintain a custom tech stack in-house will simply break your remaining bandwidth. That is why Carentix exists. It serves as the bridge for independent and mid-sized practices, delivering enterprise-level automation outcomes without requiring you to pivot your clinic into a tech company. Before you do anything else, sit down with your team, map out your internal processes, and fix the broken steps manually. Once the workflow is clean, capture the foundational wins first. Turn on automated text reminders and real-time eligibility checks as your absolute first operational move. Technology should amplify the level of care your clinic provides. It shouldn't become a second full-time job for your staff.
Carentix. Exceptional people, seamless healthcare.